This is little Joey. Like most average American kids, Joey likes to ride his bike, play with his friends, and do his homework. Okay, maybe not do his homework. Overall, Joey's a good kid, but lately, he's been having some problems. For you see, little Joey has just been diagnosed with ADHD. Join us tonight on Central Nervous News as we take a look at ADHD from the inside.
Good evening, this is CNN. I'm NT Pathway.
And I'm Serotonin! Tonight's breaking story. Little Joey has just been diagnosed with ADHD, Attention Deficit Hyperactivity Disorder. Authorities within the central nervous system have advised cells not to panic. That's why we are here, to give you the inside scoop and the story on ADHD. In tonight's episode, we will be covering psychobiology, pathology, drug indications, mode of action, pharmacokinetics, dosage, dose schedules, side effects of those medications, and their impact on counseling.
Tonight, joining our panel discussion are twin amino acid correspondents, alanine and arginine. Alanine is joining us via satellite from the frontal cortex.
Good evening.
And arginine is live on location from the corpus callosum.
Hi!
To begin our discussion tonight, Al, can you tell us a little about what ADHD really is and what it does?
Certainly. Attention Deficit Hyperactivity Disorder is a neurobehavioral disorder often characterized by a combination of specific symptoms. It's been postulated that it could affect as much as 10% of the United States population. While the disorder is certainly common among adults, it's most often identified and treated during childhood, just as in our case.
Al, you mentioned some symptoms. Can you describe them for us?
I'm sorry, what? I wasn't paying attention just then.
Yeah, symptoms of ADHD. What can we expect?
What? Oh, yes, well, ADHD is often characterized by inattention, or something. I guess that's what you wanted to know.
Okay. Any other symptoms we might expect?
Oh, bloody shut up!
Excuse me?
Hey, let me see that camera. Wow. That is fascinating. Let me see it. Hey, let me see that.
We seem to be having some technical difficulties. Please bear with us.
Oh, well, I'm so sorry. One of the other symptoms of ADHD is impulsivity coupled with aggression and intrusion into others' privacy.
Right. Okay. Any other symptoms we might expect, Al?
Yes, it's also characterized by hyperactivity.
I see. Well, Al, if you can calm down for just a few more minutes, we would all like to know exactly what causes ADHD. What might we have done to prevent it?
Yes. So sorry for that sudden outburst. Anyway, causes, yes. There are some environmental factors that might influence the onset of ADHD. Prenatal exposure to alcohol and tobacco has been identified as a possible precursor to ADHD.
Interesting. Was Joey exposed to anything like that?
We're scanning for that information now, but I don't believe so. Other environmental factors in the onset of ADHD include marital discord in the family of origin, paternal criminality, and parental mental disorders.
I'm not sure if any of that applies here, though, Al.
Lead-based paint. Lead-based paint.
What's this?
Lead-based paint.
Oh, I'm being
Lead-based
told
paint.
that ingesting lead-based paint also has been indicated as a possible factor of... Well, I don't see how that... Oh, wait, we seem to have some archival video. Yes, let's roll that video now. Ah, yes. I remember that now.
Okay, thanks for your input, Al. Now we will turn to our physiological factors with arginine. Coming to us live from the corpus callosum. R, what do you have for us today?
Hi everyone, I'm coming to you live from the corpus callosum with late breaking news. As you can see, the corpus callosum is the point where both hemispheres of the brain come together. Right meets left, left meets right, east meets west, west meets east, lobe on lobe where rubber meets the road.
R, can you get on with it?
Oh yeah, sure. Well, we've just found out that Joey's corpus callosum is actually different than normal. It seems that the rostral body is a little smaller than a normal kid's might be. That might be the cause of some of the impulsivity and hyperactivity.
Interesting. R, do you know of any other physiological causes?
Yeah, we just found out that his basal ganglia are actually smaller than normal as well.
Fascinating. R, we had some earlier reports that there might be some abnormality in regards to neurotransmitters. What have you found out?
Well, as a matter of fact, I do. I have dopamine here with me right now. So, what can you tell us, Dope?
Please don't ever call me that again.
Okay, fine. So, what's the story, Dope?
That's what I thought. Well, everyone keeps pegging this whole ADHD thing on us. I mean, normally we're enough to control emotions and reactions, but it just seems like lately there's not enough of us to go around. I mean, can we help it if Joey can't regulate his own dang self? I mean, dopamine's job is never done. It's always work, work, and work. And we're never appreciated until we don't do something. It's no kind of life. Then it's always blame the dopamine.
So, you're saying Joey's ADHD symptoms are being influenced by not enough dopamine?
I guess you could say that. But hey, serotonin and epinephrine are culprits too. Why doesn't anyone ever blame them?
Not sure. Anyway, so do you have any suggestions for fixing this little problem? Anything we might try?
Well, I'd have to talk to my friends. Well, I guess if we were stimulated somehow, or, I don't know, I guess with some,
A stimulant?
Yeah. That would be awesome. And that might kind of help us fill out the ranks again, and I wouldn't be so alone anymore.
Anything else you can tell us?
No. Now, where's my $5?
No, I don't know what you're talking about. Anyway, this has
you
been
know what? No, I want my, you promised
reporting
me
live
$5.
from the corpus
You
callosum, and now
promised me
back to you in the studio.
Thank you, R, and thank you to all of our correspondents in the field today.
That dopamine is so cute, and she's so funny, too.
In related news, doctors have prescribed 3 different potential ways of treating Joey's ADHD. Possibly using 3 different types of stimulants. These 3 stimulants all work on different neurotransmitters in the body. The first of these is Cylert, otherwise known as pimoline magnesium. It's a sympathiomimetic. Basically, its primary method of action is to work on the dopamine pathways in the CNS. Unfortunately, this drug, much like Ritalin, is not necessarily prescribed as a first-line medication due to the fact that these drugs have very serious side effects.
Wow, that is so groovy.
Right. As I was saying, although Cylert does have potentially dangerous side effects, unlike Ritalin, Cylert, again, is not a first-line drug, which means it is not the first choice of most doctors. However, Ritalin, because it just flat out works, is one of the first-line drugs. And to simulate how both of these drugs may work in the central nervous system, we're going to lie to our correspondent in the field, norepinephrine. Nor?
Hi, I'm norepinephrine with the Central Nervous News. And I am here with this very special guest joining us in the fight against ADHD.
Thanks, Nori.
My name is methylphenidate hydrochloride, but my friends call me Ritalin.
Okay, why don't you tell me a little bit about yourself? For example, how do you work?
Okay, well, I'm a mild central nervous system stimulant, and actually I activate the brainstem arousal system to create a stimulant effect. But to tell the truth, we really don't know how I produce behavioral and mental changes in children. So, hey, you know what? I'm just here to do my job. I don't really understand how this stuff works.
Very interesting, Ritalin. And how long do you plan on staying?
Well, I get to work fast. I start in about 30 minutes, and I'll stay for about 3 hours or so.
And what are your recommended dosages?
I come in a dose of 5 milligrams. It should be taken twice a day, once before breakfast, another time after lunch, which could be gradually increased to 5 to 10 milligrams per week. But you know what they say, twice a day keeps the ADHD away. But seriously though, I also come in a version of an extended release tablet, which you take twice a day every 8 hours. But just to warn you, never exceed dosages of 60 milligrams per day.
Now, are you the only drug available?
Well, yes, there is my older cousin, Peneline. Now, he's kind of similar and kind of different from me. First of all, he has the same sort of stimulant effect on the body, which is also kind of largely unknown as to how that really happens. And he's a little bit different, though, because he produces more minimal sympathomimetic effects on the body. Also, he's kind of lazy, to tell the truth. Yeah, he takes about, 2 to 3 weeks to get to work. I mean, we're talking, lazy as you can get. And he hangs around for about 12 hours in the system. And if you ask me, that just takes way too long.
Now, are there any other differences between the two of you?
Well, yes. Actually, you'd only take Pemeline as a single dose in the morning. Because like I said, he hangs around for about 12 hours. So only to take him once. And the starting dose is about 37.5 milligrams per day, gradually increased to about 18.75 milligrams at 1 week intervals. And like his maximum recommended dosage is about 112.5 milligrams. If you ask me, it's just more complicated than it has to be. I'm obviously the better choice of the two. Hands down.
Okay, Ritalin, thank you so much for taking time out of your busy schedule to come and speak with us. And now we will go back to the news desk with Sarah and NT.
Thanks, Nori, for your report. An alternative to the two drugs that we had just mentioned is something called Strattera, or amoxicillin hydrochloride. Apparently, this drug is a selective norepinephrine reuptake inhibitor, or SNRI. Its primary function is to allow the norepinephrine currently in the system to remain longer so it can have a lasting locking effect. Wait, this just in, apparently Strattera has entered the system. We're going live to location.
Well, time to get to work.
Not so fast!
What the? What's going on? Who are you?
Hi, I'm Strattera, and you, my friend, have been inhibited.
So you're Strattera, and I've heard all about you. Come on, you gotta let me go. I gotta go back to work.
That's where you're wrong. It's my turn to get to work. I'm here to fight the symptoms of ADHD.
Oh yeah? Now how do you suppose you're gonna do that?
Well, first of all, I stopped you dead in your tracks. As far as the rest goes, well, I don't really know what's going to happen, but I suppose I'll wing it.
you even get in here? And how long am I supposed to stay here like this?
Well, let me tell you, it wasn't easy getting here. I lost over half my luggage coming through the liver. Well, there's nothing I couldn't handle. As far as how I got in here, well, my protein pal Albumin, he let me in. As for me, I plan to be around for the next 5 hours or so you might as well make yourself comfortable.
So, does this mean I have to see you again?
Absolutely. First off, I'll only show up in a dose of half a milligram per day, but after a few days, I'll bump up to 1.2 milligrams per day. So that means you'll be seeing a lot more of me. But don't worry, the maximum recommended daily dose is 100 milligrams. Well, I can see my job here is done. And remember, wherever there's ADHD, you'll find Stratera.
Thank you for that late-breaking information. And when we return, we will be reporting to you from a new location right after this.
Hi everyone! I'm a crazy gang here! You can come down to my warehouse at the corner of Cerebrum and Cerebellum for our biggest blowout sale of unused organs. You can get this week only 2 wisdom teeth for $29.99 and our best price ever on the most amazing item! An appendix only slightly used! Today only we're cutting prices in half from $99.99 to... It's crazy! $79.99! Isn't that wonderful? Come down, free tonsils for all the children!
Man, I'm hungry. Where's that pizza guy?
I don't know, man. It's getting late.
Jeez, we're going to be on in just like a couple of minutes here.
Oh, jeez. I don't even have time to brush my teeth. Oh, I think he's here.
He must be.
Okay.
Dude, your pizza's here.
Yeah.
All right. Oh, guys, we're
Oh
on.
my god. Oh my god.
We're on.
You come
Quick,
here, come
somebody's got to get up
here.
there.
Sit down. Just sit. Sit. Read it. Read it.
The script, man, the script.
Read it. You're natural.
Read the script.
Now that we have heard about the several major drugs used to treat ADHD in children, let's interview each of the side effects. Now the side effects for each of these drugs can be a little unpredictable and moody, but we have managed to capture some live footage of each side effect on little Joey. Let's go to our correspondent on the field who was live at the scene. Correspondent,
All right, cut it.
are you there?
Cut it.
I know. Okay. Hi, this is Sarah Tonin reporting live at the scene. I'm here with little Joey, and we're about to see live the effects of the antidepressant Stratera on little Joey's ADHD. Watch closely as we see these side effects in action. Joey, you're not hungry. Put the food down. Food is not good. You're not hungry. It's disgusting. Ugh. It's nasty. 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 You don't want any food. That's the last thing on your mind. And now, how about a little upset stomach? So fun.
Whoa, that was simply fascinating. On behalf of all of our viewers and us here at the newsroom, I was wondering, Sarah, if you have any footage of the side effects that Ritalin would have on that little Joey dude.
I am so thrilled that you asked. Here it is live, in person, on camera, the effects of the stimulant Ritalin on little Joey. Here it is, pizza guy. Hey, Joey, I know you're supposed to be getting taller and stuff, but now that I'm here, you don't need to. Why don't we just stay petite? I just feel like cussing. Guts!
Guts!
Poopy!
Poopy!
Double poopy!
Double poopy!
Tinkle!
Tinkle!
And how about a little tick?
Joseph John! Where'd you learn those foul words? I'm gonna wash out your mouth with soap, young man. And then straight to bed.
It's not bedtime. I know it's bedtime, but it's not bedtime. Joey, don't go to sleep. You're not tired. Just don't go to sleep. Wake up, wake up, wake up.
Wow, that was awesome. As we can see, the side effects of Ritalin can be serious. Insomnia, loss of appetite, depression, and impairment in the growth process, along with Tourette and tic symptoms. Bummer.
Indeed, pizza guy, or should I say PG. I couldn't have said it better myself.
Yo, Sarah, what if the little Joey dude doesn't want to take a stimulant? What are we gonna do then?
Hey, that's not in the script.
Pizza guy, we are on the same wavelength.
Totally.
Truly, I tell you, I have alive here the effects of clonidine on our tender young Joey. Clonidine is a non-stimulant, and here are the common side effects associated with this drug.
Joey, don't you think you're getting a little bit tired? Don't you want to go to sleep? Rest your little eyes and drift off to the dream. Joey, isn't your mouth a little bit dry? Wouldn't you like some chapstick?
Well, this has been Sarah Tonin reporting live, and now back to you, pizza guy.
Dude, Sarah, that was like totally awesome, man. Hang 10. And now we're gonna go to our correspondent, Nori Pinephrine. Is that like a drug or something?
Hi, this is Nori Pinephrine reporting live from the limbic system here with our latest reports. It seems that the most effective strategy for treating patients with ADHD is the combination of behavioral modification psychotherapy along with the administration of medication.
Okay.
According to our latest report, stimulants such as Strattera and Ritalin are clearly effective. Most children with ADHD will improve on stimulants, with the percentages ranging from 70% to as high as 96%. Stimulants not only affect the major symptoms of ADHD, but also affect a host of social, cognitive, and academic problems. In regards to social problems, stimulants improve the mother-child and family interactions, reduce bossiness and aggression with peers, and increase the ability to work and play independently. Cognitively, short-term memory is improved along with the use of strategies already in the children's repertoire. Academically, classroom talking and disruptions decrease, while both the amount and accuracy of academic work completed increases.
Whoa, that is far out! Right on, man!
Okay, now don't get too excited about that, Mr. Pizza Guy. There are a few side effects to be noted. Mild appetite suppression is common, and some children tend to respond with irritability, headaches, and abdominal pains. However, children do not become zombies when on the medication. Instead, they are actually much more alert and focused.
Whoa, zombies! You know, one time I saw this killer zombie flick, man, where they started like munching on each other's heads and all that. Yeah, okay, yeah, back to you.
Medication does not remedy all the problems that beset children with ADHD. Specifically, it may not affect comorbid conditions, parental psychopathology, academic and social skills, and peer popularity. Therefore, it is necessary to supplement the prescribed medication with the use of individual behavioral modification. In the operant approach, environmental rewards and punishments, along with the use of modeling, are used to decrease problematic behaviors and increase adaptive ones. In the short term, behavioral interventions improve social skills and academic performance in the school setting. In addition, it is also helpful to implement social skills training, parent training, and academic skills training.
Yeah, dude, I'm like totally there, man.
So in light of this recent information, it seems that little Joey will be in good hands. This is Nori Penefrin reporting live. Back to you at the studio.
Dude, this has been awesome. Are you guys like hiring or anything? Because I kind of need a job now. I think they're gonna fire me when I didn't come back with the pizzas. You know, I help a bro out. You know what I'm saying? Because I can like totally do this news thing. You know, this is me reporting from the Central Nervous News. Rock on, man!
This has been a broadcast of the Central Nervous News. Until next time, sleep tight, little Joe.
Tonight, joining our panel discussion are twin meal acid correspondents Alani and Artemy. Alani is joining us live from the floor.
You know, I am deeply offended by this attitude. I'm doing the very best I can here, okay? I am not an actress.
Al.
Oh, wow.
Hi everyone, I'm coming to you live from the corpus callosum with late breaking news. As you can see, the corpus callosum is the point where both hemispheres of the brain come together. You didn't can.
Oh, dang it, sorry. Dang it, sorry, I'll get it right this time.
To simplify what I'm saying here, without conditions, I'm going to go with my first line of the What is your name?
Then what are you?
Not an actress.
So Brady.
Oh, you want me to say that?
Yeah, look right in here. And say.
I'm not an actress. I said I'm not an actress. Is that what you want me to say?
Fine, thank you.
It's never done. It's always work, work, work.
So you're saying Joey's ADHD symptoms...
I wasn't done. People always blame the dopamine.
Let's try it again.
Assume that I activate the brainstem system arousal system. Okay, Uber.
We saw the Missy answer for a minute.
I know. Can Nori use the Missy hands?
No. Then they'd be the Nori.
Well, as an oral tablet.
Oral tablet.
The director is not supposed to crack up.
Damn it!
Okay, well, I'm a mild. I totally forgot what I was gonna say.
Oh, just go.
Oh, okay. Hi, I'm Nori Penefrin, and with the Central Nervous. It's that! It's because you got it confused in my brain!
Once before breakfast, and another time after lunch. Because you know what they say, twice a day keeps the ADHD away. And I can't watch that one.
Do that again.
What did he say?
Oh, excuse me.
Remember, safety is no accident.
You look like a deer in headlights.
I feel like a deer in headlights. I am not a best
Poopy!
Joey, don't you think you're getting tired and you want to go to bed? Isn't that Irish? Let's try it again. Let's try it again, Jeremy. Okay.
So, dude, like the other day, I was totally like riding this gnarly wave in the stomach. It's like all this gastric acid juice flowing around. I'm like, whoa, man, what's going on?
Joey, don't you think you're getting a wee bit tired?
You just you're crossing the sea. Okay.
You try-
First you didn't want the people.
I don't want the people. I don't want the people.
Now you want the
I
people.
don't want the people.
You said you feel alone.
Well, I know. I can't seem to make up my mind.
Joey, don't you think you're getting tired and want
Too much. There's too much H in think.
Think.
Dink. Tink.
Dink.
Tink like T-I-N-K.
Okay, I'll just
Or
go
D-I.
D.
Don't you dink?
Don't you dink?
Ah, that's it.
Okay. Are you gonna give me a countdown? That might help.
Okay, I will. Ready? Ready?
And then close your eyes, okay?
Hello? Is anybody else there? Dude, I'm kind of like scared of the dark, man. Oh, dude! That's like really freaking me